How can you help reduce your chances of developing cancer in your lifetime? Let's discuss some of the factors that can influence the cancer risk. Whilst age is not a factor that anyone has any control over, it is important to be aware that a majority of cancers tend to affect us as we grow older. Therefore, the message is that the older you are, the more vigilant you should be towards the warning signs and symptoms of cancer. Having said that, it is important to realize that cancers can happen at any age. Smoking is also a risk factor for developing cancer. If you are a smoker, you will be at a much greater risk of developing cancer than a non-smoker. So, if you want to reduce your risk of developing cancer, you need to take steps to stop smoking. It's never too late to quit smoking. Most areas in the UK will have a smoking cessation service that will be able to assist you with this, either online or via your GP surgery. There is a much higher chance of success when using these services compared to doing it yourself. Whilst not an ideal solution, e-cigarettes are considered a safer alternative to smoking. Alcohol excess is known to increase your risks of developing cancer. Most people are unaware that in any given week they may be drinking harmful levels of alcohol. A large proportion of the general public use alcohol to help them relax at the end of a busy and stressful day. But the units do add up. Keeping your alcohol consumption within the safe recommended limits will greatly improve your health and reduce the risk of developing cancer. If you are unsure of how much you may be consuming, I would recommend visiting the Drinks Checker page online to assess your weekly intake. Alcohol also makes you pile on weight due to the high calorie content and could lead to obesity, which in itself is a risk factor for developing cancer. Another risk factor for developing cancer is a poor diet. Having a good balanced diet with lots of fibre and less sugar and less saturated fats is known to reduce your risk of developing cancer. Processed foods and processed meats are known to increase this risk. And don't forget to eat a good amount of fruit and vegetables on a regular daily basis. Obesity is the single biggest preventable cause of cancer after smoking. It's thought that in the United Kingdom, more than 1 in 20 cancers are linked to being overweight or obese. A body mass index, or a BMI for short, is used to see if your weight is in the normal range. A BMI of greater than 25 and less than 30 is indicative of being overweight, whilst a BMI greater than 30 is indicative of being obese. There are online calculators that can help you calculate your body mass index to assess if you are overweight. Inactivity or lack of regular activity will also increase your risk of developing cancer. Aside from reducing your risk of developing cancer, regular exercise will help to reduce your chances of obesity and to keep you fit and healthier for longer. Be familiar with your own body. Know you're normal. Examples of this are females self-examining their own breasts on a regular basis, or, in the cases of males, examining their own testicles on a regular basis. Being body aware will help you spot abnormal changes early and give you the best chance of survival and good health. Screening tests. Screening tests are a vitally important way to detect very early stages of cancer, even before you may have noticed any changes in your body or even experienced any symptoms. In the United Kingdom, screening tests are free on the NHS and are offered to eligible patients to screen for bowel, breast and cervical cancer. The eligibility depends on age. Bowel screening. In England, Wales and Northern Ireland, people over the age of 60 are invited to take part in bowel cancer screening. In Scotland, the screening starts from age 50. You will be invited to take part in screening every 2 years until you reach the age of 75. Each of the screening programs in the UK use home tests which look for hidden blood in the poo. If you are registered with a GP and within the eligible screening age range, a test will be automatically posted to you, so you can complete it in the privacy of your own home. Breast screening. The NHS breast screening programme invites all women aged between 50 and 70 for screening every 3 years. You will need to be registered with a GP to receive the invitations. If you are older than 70, you can still have screening every 3 years, but you won't automatically be invited. To make an appointment, contact your GP surgery or your local breast screening unit. Cervical screening. The NHS Cervical Screening programme is available to women aged 25 to 64 in England. All eligible women who are registered with a GP will automatically receive an invitation by mail. If you are aged between 25 to 49, you should be having a smear every 3 years. If you are aged between 50 and 64, you should be having a smear every 5 years. When you are invited or offered screening for these cancers, please make sure you take the NHS up on its offer and that you do so promptly. This could save your life. All too often as a GP, I found that patients who declined screening in the past and later went on to develop cancer had a much poorer chance of survival. I chose to end this video by discussing screening as I feel that it is an important weapon in our fight against cancer. Thousands of lives would be saved each year if everyone who is invited for screening would attend. I've seen firsthand the devastating effects of cancer on patients and their families. A few hours of your time attending screening tests must be worth being able to avoid the tragic consequences of developing cancer. We owe it to ourselves and our families.